Our topic today is ICD-10-PCS coding for vascular procedures, a challenging and complex topic for many coders. I'm your presenter, Lynn Kuehn. The vascular subject for today is two-part bypasses. I've received a number of questions about two-part bypass devices and how to properly code these. As the surgeon makes the surgical plan, they determine the type of device that will be used. In certain cases, they may have to use two different types of devices to create a bypass. Let's look at some images of common two-part bypasses from the Romanian Journal of Cardiology. They do have some spelling differences in Romania, but the images were too good to pass up. I've seen the first three of these in the documentation. Those are the Miller's, the Linton, and the St. Mary's boot. These are all different ways to connect a bypass using an additional autologous tissue device along with a synthetic graft, usually a PTFE tube graft. I've never seen number 4, the Taylor patch, but perhaps some of you have. I have had some conversation with coders about how these are coded to account for the two devices that are used. Many coders feel that because there are two devices, we have to account for the devices with two different codes, and I agree with that. Let's use image number 3, the St. Mary's boot. In this example, we will say that the bypass is from the right femoral artery to the right popliteal artery using a PTFE graft, that's the white conduit, and an autologous piece, the blue patch. Some coders believe that we should code two bypasses, one with a synthetic substitute and another bypass with autologous tissue, shown here as option 1. However, this seems to indicate that two separate conduits were connected between the femoral artery and the popliteal artery, and that's not really the case. Let's look at option 2. The bypass here is made with the synthetic substitute, the first code shown. But the autologous graft is actually a patch added to the destination, the popliteal artery. This patch allows the blood to flow smoothly out of the bypass graft, reducing the likelihood of clot formation. I believe a code for supplement is the most appropriate as the second code. This identifies the bypass conduit with one code and the supplement of the destination with another code, both indicating the appropriate device that was used. It's my opinion that it's more appropriately coded as option 2. Any of these two-part bypasses would be coded in the same way. One code for the bypass with the appropriate device, and one code for the additional tissue added to the destination artery. I think this coding describes the objectives of the procedures accurately. I hope these images and my explanation have been helpful. The Vascular Roadmap flashcards are available from Libman Education at this URL.